Hello, this is Dr. James Camp at Lee College in Baytown, Texas. Welcome to my lecture on blood types and blood typing. What are blood types? Let's imagine that we have 4 red blood cells as depicted here. At first look, at least if you looked at them in the microscope, they'd look exactly identical. But if we had a special microscope that could show us, or a special stain that could show us the glycoproteins on these cells, we'd see that they each had somewhat different decorations, if you will. This blood type, this blood cell here has A antigens on it. Okay, that's glycoprotein A covering the surface of this red blood cell. The next red blood cell has glycoprotein B covering its cell surface. The third protein in the row has both glycoprotein A and glycoprotein B. And then the fourth red blood cell has no glycoproteins on it at all. So what do we do with this? Well, we define which set of glycoproteins a blood cell has as its blood type. So we would call this cell type A. This next cell, type B. The third cell would be, guess what? Type AB, because it has both A and B. But what do we do with this last cell that doesn't have either glycoprotein? Well, we notice that it has 0 glycoproteins on it, and the English letter O looks a lot like the number 0. So we call this type O. Clever? Well, maybe, maybe not, but that's how it works. So that's the basics of blood typing. If you're a type A blood type, not a type A personality, but if you have a type A blood type, then every blood cell in your body will have A glycoproteins on it, but not B. If you're a type B blood type, then every blood cell in your body will have B antigens on it. Every red blood cell, I should say, will have B antigens on it, and none of your blood cells will have A antigens. If you're a blood type AB, all of your cells will have A and B. If your blood type is type O, then none of your red blood cells will have any of these glycoproteins on them at all. Well, we got along fine with just type A and type B for a little while, but then people started noticing that there was still some incompatibility among blood types, and they wanted to know, what else might be out there. And in fact, there is a third blood antigen, okay, which is dubbed RH because it was discovered in the rhesus monkey, which is spelled R-H-E-S-U-S, rhesus. Some blood cells have RH on them. Other blood cells, as you notice here, other red blood cells do not have RH. Rather than adding another letter to the blood type, scientists decided that the presence or absence of RH would be considered a positive or a negative blood type. So you're either RH positive, meaning that you have RH on your blood cells, or you are RH negative, meaning you do not have RH on your red blood cells. So this first blood cell here would be type A positive. The next blood cell would be type B negative. The next, the third patient here would be type AB negative, and the fourth patient would be type O positive. Got it? Okay. Well, what's the problem with blood types? Let's start by re-summarizing our types. So patient 1 was type A. Patient 2 was type B. Patient 3 had both A and B antigens in her blood. And patient 4 had neither A nor B antigens on his blood. So what's the problem? Well, as a matter of course, your body makes, your immune system makes antibodies against whatever blood glycoproteins you don't have. Okay, so you can have there are three possibilities here. You can have an anti-A antibody, you can have an anti-B antibody, or you can have neither. Okay, or you can have both. So I guess there are four possibilities. Anti-A antibodies, they look like all antibodies. They're these little Y-shaped dealies. Okay, but they have recognition sites for A antigens on their surface, whereas anti-B have recognition sites for B antigens on their surface, or on their variable ends. So what does patient A have in her blood? Well, she has A antigens on her blood cells, so she's not going to have that antibody. What she's going to have is anti-B antibodies in her blood. Patient 2 has B antibodies on his blood cells, so he's not going to make those antibodies. What he's going to make is anti-A antibodies hanging around in his blood. So what happens if you give a transfusion from patient 1 to patient 2? You've now got anti-A antibodies in the blood of a patient who's also got A antigens on their blood cell. Starting to see the problem? The anti-A antibodies will bind to the A antigens on the blood that you're giving as a transfusion, and suddenly you'll have a reaction called agglutination. The red blood cells will start sticking together because of the antibodies sticking between them. Ultimately, one of two things will happen. The red blood cells will all split apart, called hemolysis, which means the transfusion is just a dud. Or perhaps worse, the agglutinated clusters of red blood cells can lodge somewhere in the form of acting somewhat like a blood clot, and can disrupt blood flow. So it can also be a potentially fatal problem. So ultimately, we don't want to do this. We don't want to give a patient who has a particular antibody the blood with the antigen that antibody is against. Okay. But I mentioned that we discovered over time that there was a bigger rejection problem, and that had to do with, or there's another rejection problem, and that had to do with the presence or absence of RH factor on a patient's blood. Now you remember that patient 4 was type O positive, so they had RH antigens. Patient 3 was type AB negative, so they did not have any surface antigens. So let's look for a second at what antibodies are going to be in these patients' blood. Well, patient 3 has A and B glycoproteins, so they would not make anti-A and they would not make anti-B. So far, no antibodies. Patient 4 has neither, so they're going to make both anti-B and anti-A antibodies. So you would think that if I gave a transfusion of blood from patient 4 to patient 3, there would be no problems. There are no antibodies, after all, in patient 3's blood. Well, the first time you do this transfusion, there's no problem. But as soon as patient 3's immune system sees those Rh antigens, guess what they're going to get? They're going to get anti-Rh antibodies. So if patient 3 ever gets another transfusion of Rh positive blood, then you'll have an antibody reaction between the anti-Rh and the Rh on patient 4, on patient 4's blood. So we try not to give positive blood to negative patients so that we don't risk that reaction happening. Okay, let's summarize some of the details then about which antibodies and which antigens are present on which cells, and see if we can figure out who's supposed to donate to or receive from who. Okay, so who has antigen A? Well, if you've got the letter in your blood type, then you have that antigen. So type AB and type A both have the A antigen. If you've got the letter B, then you've got that antigen. So type AB blood has B antigen, and type B blood has B antigen. Notice that type O blood has neither. But what about the Rh antigen? Well, remember, if you're Rh positive, you have Rh. So that would be AB positive, A positive, B positive, and O positive. Okay, so now we know what antigens are present on the cell. What antibodies are present in the blood? Well, if you don't have the antigen, you'll make the antibody. So nobody in the top 4 makes anti-A, but we'll see anti-A here in the lower 4, in the B, type B, and type O patients. If you don't have B, you'll make the anti-B antibodies. So we'll see anti-B present in the type A patients and the type O patients. Now, you don't automatically make Rh antibodies, but we're going to act as if the patient does for the purposes of doing a transfusion, because we don't know if a patient comes into the ER if they've ever had exposure to Rh positive blood or not. So we treat it as if they do. So this patient, we're going to act as though they have anti-Rh antibodies because they're Rh negative. Okay, so if you're negative for Rh, we'll pretend that you have anti-Rh antibodies, or we'll assume that you might. Okay, so now we've got a map of who's got what antigens and who's got what antibodies. Now we can think about who we can donate blood to and who we can receive blood from. Okay. A type AB positive person can give blood to anybody who doesn't have anti-A, anti-B, or anti-RH in their blood. The only people who don't have any of those antibodies are patients who are AB positive. See how that works? Patients who are AB negative, we only need to look for A and B antibodies. Well, there are A and B antibodies on every single blood type except the ABs. So we can donate to AB positive or AB negative. A patient with A positive blood, we need to find someone who doesn't have A or RH. Okay, this is a little trickier to look for. Obviously, we can donate to an AB positive patient because they don't have any antibodies. The only other person who doesn't have any A's or RHs is someone who's A positive. A patient who's A negative can give blood to anybody who doesn't have type A blood, so that's AB plus or minus and A plus or minus. Those are the people who don't have anti-A antibodies. Okay, and if you follow this logic, we look for B and RH, and so we find that the people we can give B positive blood to are AB positive and B positive. The people who we can give B negative blood to, anybody who doesn't have the green anti-B antibodies. So AB plus or minus and B plus or minus. And whose blood can we give O positive blood to? Anybody who doesn't have a red RH antibody. So that would be AB positive, A positive, B positive, and O positive. And who can we give type O negative blood to? Well, there are no antigens to look out for, so anybody. Okay, and that earns type O negative blood the name universal donor. If you are type O negative blood, everybody, every blood bank in the world wants your blood because you can give blood to anybody. Who can we receive blood from? Well, another way to go through this is to say, well, type O negative here at the bottom has anti-A, anti-B, and anti-RH antibodies. So we can get blood from anybody who doesn't have a blue, a green, or a red letter next to their name in the antigens column. That would be only type O negative. Okay, so they may be the universal donor, but they are out of luck when it comes to getting transfusions. Type O positive, we only have to look for blood types that don't have a blue letter A or a green letter B. So that can be O positive or O negative. So we've got twice as many possibilities for that one. Type B negative blood, we have to look for people who don't have A's or RH's on their surface. So we can include type B negative in our list here. Type B positive, we only have to avoid A's. So we can have O positive negative or B positive negative. So you can sort of start to see if you've got anybody can get an O. If you've got the letter in your name, you can get that kind of blood. Anybody can get a negative, but you can only get positive blood if you have the positive in your blood type. So based on that, we would guess that a type A negative patient could get O negative blood, and they've got the letter A, so they could get A negative blood. Patient with A plus blood can get O positive or negative, and A positive or negative. And finally, type A B blood, they've got all the letters. We only need to look out for RHs, so they can get O neg, A neg, B neg, or AB negative blood. And who can an AB positive get from? Well, they have no antibodies to react to anything, so they can receive blood from anybody. And that makes AB positive a universal recipient. All right. The last question you may be asking about this blood typing business is, how do we know someone's blood type? Okay, before you do a transfusion, with anything other than type O negative blood, you want to know the patient's blood type so that you know what kind of transfusion to do. Well, it turns out that we can manufacture the 3 types of antibodies we need. Okay, we can manufacture a little vial of anti-A. We can manufacture a little vial of anti-B, and we can manufacture a little vial of anti-RH, though most often it's called anti-D for some reason. I don't know what happened to the letter C. Somebody didn't like C. So we've got anti-A, anti-B, and anti-D. We can then take a little well plate, okay, and we take a drop of the patient, a few drops of the patient's blood, okay, and then we take a drop of our anti-A and a drop of our anti-B and a drop of our anti-D, and then we take a little swizzle stick and we mix them together, okay, and we get one of 2 reactions, okay. We might get a nice even coating of blood, okay. That means there's been no reaction. We might get a speckled look. That means the antibodies have started cross-linking the red blood cells. They've started an agglutination reaction. And so we would say that that's, we would call this a negative result, and we would call this a positive result. Okay, so let's say we saw another agglutination result on this, so we'd call that a positive result as well. So how do we read this? Well, if it's a negative result, we don't include it in the blood type. If it's a positive result, we do include it in the blood type. And then whatever result RH is, we do include that, and we include the positive or the negative in the blood type. So this patient is negative for A, so we don't include that in the blood type. Okay. They are positive for B, so we do include that in the blood type. And they're positive for RH, so we would call this patient type B positive. Okay? Now I think we should all be positive, but this patient is type B positive. Okay. So let's give you one to just look at. Let's say we had an agglutination reaction here, and no reaction here, and no reaction here. What would you call that patient's blood type? Well, we would consider this a positive reaction. We would consider the other 2 wells negative reactions. Okay. So we would consider type A to be part of the blood type. We would consider type B to not be part of the blood type. and we would consider the RH attribute to be negative. So this patient is going to be type A negative. All right, and that summarizes the basics you need to know about blood types and blood typing. Thank you for joining me today, and enjoy your anatomy and physiology.